Welcome to the Healing Grove podcast. I'm Dr. Kristin, an integrative holistic family physician, author of Life After Lyme, and host in this virtual space of learning, healing, and growing. I believe humans are like trees, and our physical limb is only one of many. Health on all limbs of the tree, emotional, conceptual, social, spiritual, is absolutely required for the whole tree that is you to be vibrantly well. I created the Healing Grove podcast as a place to showcase some of the world's best integrative and holistic medicine, to expose you to transformative tools and mindset shifts for all limbs of your tree. I hope you enjoy our conversation in the Healing Grove today as much as I enjoyed having it. Welcome, my friend Lori. How are you today?
Good, thank you. Thanks for having me here today.
Oh my gosh, thanks for being here. So I'd like to introduce you to everybody. Everybody, this is my dear friend Lori Haring. She's a physical therapist who specializes in the treatment of chronic pain with a special emphasis on pain in the abdomen and pelvic floor. Lori has been really led to this work in part through her own healing journey from chronic illness. An avid lover of the outdoors and a busy mom of 5 wonderful children, she's continually learning how to balance her roles of mom, wife, daughter, sister, friend, woman, and therapist. And in fact, it's part of her life mission to help others learn to do the same, even as they're in the midst of recovering from complex medical syndromes. Lori is grateful for the opportunity to walk alongside her clients on their healing journeys and to witness their growth. So thanks again for being here. You have so much wisdom to impart to this group, and I'm just really delighted that you are joining us today.
Glad to be here.
Before we get into some tools, I would love for you to share the story of how you came to this healing profession.
Well, initially as a physical therapist, I entered into the specialty of neurologic function, brain injury, learned a lot about what the individuals go through in the trauma process and recovery from that, and families. About 10 or so years later, we started our family, and my initial first childbirth and my delivery left me with a pelvic floor dysfunction. And so I sought out a physical therapist. I knew that that would be someone that could help me with this problem. And the problem was a little bit too severe to be sort of solved completely with that round of therapy. So I decided as a PT myself, I would just go to a course so that I could learn a little bit more about what I needed to do. In the course of that weekend, I decided to really just shift my entire focus, basically get a new job as a PT and develop the skills and begin to work with women who were dealing with issues related to childbearing and delivery. And so I initially set out to primarily treat women in that phase of life. And then I more often was exposed to women who were in pain, chronic pain, and other sorts of female-related health dysfunctions. And I continued schooling to learn more about how to help those women. And then I actually grew quite frustrated with the most severe of situations for some women that either therapy caused more inflammation, irritation, and we were sort of stuck. And so my gears shifted towards a different type of training that include visceral mobilization and craniosacral release. And it was then that my patients were starting to access more of their healing capabilities through this type of work, through really hitting at the restrictions more appropriately and tying in some of their history, some of their trauma, some of their emotional wounds were also able to be accessed. And so the healing possibilities just were hugely improved with those tools, with the addition of those tools.
So is it common in physical therapists to have this awareness? Is it part of your training in physical therapy to understand that the body really holds trauma, emotional trauma in the body?
We were taught in school to treat holistically, with regard to nutrition, and that health is a total body concept, and that if someone has a knee injury, it might come from somewhere else. But more speaking of another joint or another area of the body, another physical issue. Not so much that trauma and emotional pains would reside in the body. I did not learn that. I went to school longer time ago. I've been a therapist since '93. So if that's part of the curriculum now, that would be great, but it wasn't when I was in school. And really I always thought, we had just an intro to psychology. We didn't really have much of a component of psychology in our work.
So what about your own journey led you to discover that or to lean into that sort of new paradigm?
Well, in terms of healing journeys, I did experience in college the traumatic loss of a boyfriend. We had been a very serious relationship, and it was an accidental death, but not completely accidental by the hands of another person's actions. So that rocked me to the core, really, really. And it was the first time, it was the biggest time in my life where I could say, like, that gut reaction. At that moment, I didn't eat for 4 days because my stomach was in like painful knots. My head was racing with thoughts. There's moments of that initial period that I don't remember at all. And then there's pinpointed pictures of moments that I remember as if they were yesterday. And so I didn't really realize that I experienced the trauma until later, in terms of like that, what that all encompasses. It took me longer than I would have wanted to heal from that. Part of it is when you lose someone, though, when you're healing, you're feeling as if you're not respecting the person that's lost. You somewhat hold yourself back. So I definitely did that. So I had different steps of healing that I can say were, I'm sure that there was lots of ups and downs, and it was very gradual along the way. But at certain key points, I had this strong readiness to move to the next level. And that urge of that readiness, along with having tools of other people to help me, gave me the kind of impetus that I needed to move forward. So like at 6 years, I gained acceptance of that loss, realizing that I had changed in that 6 years and I wasn't the same person anymore. So at that, the person that I lost probably wasn't my perfect match anymore. And so I had grown in different ways. Obviously, anything that's challenging in your life will force you to grow in different ways. And so I did feel that. And so if that wasn't meant to be anymore, then that acceptance was allowed to come in. And I accepted the loss, and that I was freed up to move forward in my life. So I did. I married a wonderful man. My husband and I have been married almost 22 years. And so that freeing allowed me to move on and create a meaningful, lasting, another wonderful relationship. And so the next thing that I noticed it, but I didn't really realize what it was, is that about the incident happened in the spring. And so when the first signs of spring would come, I would enter into a depressive state, and it didn't change my functionality in any way. People wouldn't have known. I was very good at just kind of going along, and it was what I felt. And at that day of the anniversary, it was literally gone. Like I washed the car and the depression went away. And it happened every single year. And I noticed it after several years, and I just kind of dealt with that. I didn't really know that there was anything better to be done about it. I thought that this happened to me, and this was just part of what was my experience now. And so I found myself mid-April in a massage therapy session with a friend and colleague of mine. And she is very skillful at tapping into the body's wounds. And so we were working on my neck because of a chronic neck issue that I've had. And she felt a sense of an emotion connection to me. And so we discussed and processed through that session. I did share the story of what happened, and but I wasn't trying to do anything there. What we did end up doing was what's called an SER, Somato Emotional Release, in that session. And so when I left that session in mid-April, I didn't feel the depression. I felt lighter. I was like, wow, it's gone. And it was 3 weeks before the normal time that feeling would have left me. So I said, my skeptical self said, okay, well, I'll take it for this year. That was 1 hour and I'll take it. And so I didn't necessarily think that it would have had a lasting result. But the following year came along, more than a whole year later, the anniversary came upon me. And it was then that I realized that I never got the depression again. And that's 6 years ago, and I've never gotten it again. So
Wow.
that session, and I was ready to shed it. I think that I felt sorry for myself. I was holding on to the fact that I had to go through this trauma and suffer that loss. And so I was ready to be freed of that oppressive, heavy thing that it hit me every spring. So I've never had it again. So then I thought, well, I'm really cleared of all of the emotional connection to this loss, and I still have a connection to the family. I still keep in touch with his parents and his brother, and so it's not. I don't ever want to come across that it lacks meaning for me. It's just about personally not feeling oppressed by what I went through. And so last year, when I found out that I had been dealing with chronic Lyme, I was seeking assistance with a nutritional support person who works also very holistically and can tap into kind of the emotional level of a person. And she said, there's something kind of old here. And I thought, I don't think this is really affecting me anymore in that way, but we'll see. And so she kind of gave me for my week's homework some affirmations and some healing words to say and some tapping processes. And another level of healing was acquired because I didn't really realize it, but anytime I would tell the story, my emotional level went up with it, as if I was there living in that situation that happened. And now as I sit here telling you, I'm telling you about it. I'm still sad for the loss of the life and for the family, but I'm not put back in that emotional state that I lived in for all those years. I will never now say I'm completely healed because I kept thinking I was good and I wasn't. So now I'll just say it's a process, it's a journey, and as long as the foot's on the gas, whether it's going fast or slow, as long as we're going forward, that's what counts.
Wow. So that there's a real humility I'm hearing in there of like, you know what, maybe we're never done. You're definitely better and better and better. And life has a tendency to kind of revisit and scratch those wounds in different ways. And we're different people when that, each time that happens. But it's a powerful thing to hear you say that, we may never be done. I may never be done. And yet I feel so much better.
Mm-hmm.
Yeah. Thank you for sharing that story.
Welcome.
A powerful story. One of the things I heard in there was just the importance of being open to what's emerging. As I'm thinking about you and those various kind of time frames you just described, you just seem so open to what's in front of you. And I wonder if that's something that comes naturally or if that's been a struggle. I find myself when things pop up, like for example, the story of, every year it came around, I just figured this is what I had to live with. I find that that's a very Zen approach, and I sometimes wish I could be a little bit more Zen about things. When things crop up, symptoms come up, I'm like, what is that? How do I deal with it? What do so I wonder if you could share a little bit about how you came to that way of being.
I think that, well, initially healing for me was very introspective. I would handle little bits and pieces in pockets. So when I first was going through those initial years, I would allow myself to be sad and mourn and grieve. And then I would pull myself up and be like, okay, let's put that in the pocket and get on with life. And because I had to go right back to school. I had to finish my program, my physical therapy program. I was right in the middle of that. And it had come at a time where I had just lost my initial, like, the first loss of life in my family was the year before. And that semester, there had been 3 other family deaths. So I think being 19 years old and having all that be the first time I experienced it and having so much didn't help. So I had to kind of compartmentalize things. And so by the time I made those shifts that it took me a while to realize what I was dealing with first. So I wasn't necessarily like just okay with it, but I thought this was the only way. And by the time I was dealing with that depression for those many years, the thing that didn't push me to fix it is because it always went away within like 2 months.
Mm-hmm.
And so it wasn't that imposing on me. Although after then 20 some years, then it was. I was like, this is not okay. And so that's why it was the amount of times that I thought, wow, like this shouldn't have to be this way. Initially it was only a couple months of time, and so it didn't really bother me. But after the years, I thought, I'm not okay with this anymore.
Yeah. So are there tools that you could share with us for how people might start to, I mean, both of yours involve body work, right? There was the massage and there was the SER. So are there things that people could do for their own bodies to help them connect to their old wounds and maybe begin to release them?
So I believe that our bodies always want to heal. And so if you cut yourself, that cut's always going to heal. And you may have some predisposing factors that take that time, increased time to do that. So if you have diabetes, your wounds may heal slower, but your body still wants to heal and still typically does. And so I think it's the same with emotional wounds and physical wounds, the same. And so we have our energy that's running through our body. We have the nervous system that's sending signals to do all of the bodily functions. We have our blood that's pumped through from our heart. We have our lymph, that's a lymph fluid that's going through with no pump. We have another system called the craniosacral system. And that is the brain and the spinal cord are all connected in one system. And there's protective coverings around all of them. Inside of those coverings is the craniosacral fluid. And it's being created in the brain, in the ventricles, and sent out through, as you know, through and around all the spinal cord in the brain. And that fluid is, trying to think of the word, it's supporting the nervous system function. And so if you have an injury or an insult somewhere in your body and that craniosacral system gets interrupted or interfered with, you're not going to have the flow, and that's going to interfere with function, maybe cause dysfunction and pain. So working with that system is really, really helpful to help restore the movement. And so there are some releases that you can have done by a therapist with yourself, or there's ways that you can do craniosacral release on yourself as well. Another tool that I've utilized a lot is the Visceral Mobilization Release. And sometimes when we deal with trauma, the emotional pains are stored within our body in our organ system. So like there's research that shows like fear is held in the kidneys, and loss of abandonment type issues maybe in the lungs or the chest. And so when you're working with restricted organs in that way, you don't with a patient, you don't even have to ask the person. Their body needs to be ready, but it comes out if they're ready. If they're not ready, they're probably going to push you off of that area. And when you are listening to their body, you will identify where you're supposed to be, where the body's ready for you to be. So when you're working in an area that the body is ready to be worked on, then things can be facilitated and released. And so some of that work was part of what I received as well.
Beautiful. So it's what I'm hearing is it would be great to have an intuitive, connected therapist like yourself who can read the body signals, and then support the body in healing and restructuring some of those tight or stuck elements in the viscera. What about for people who want to experience a little bit of this on their own? Is there something we can do? Can we learn a little technique today to help us release some aspect of our stuckness?
So breathing is an important aspect to helping facilitate the body's healing process. The breath that we take in is the gas for the engine. It's feeding all of our cells. And so if we're not breathing deeply and properly, we're not getting the part of the nutrients that those cells need. And so diaphragmatic breathing is a way to help build up a deeper breath work so that your lungs can fully expand, and so that the oxygen can get to further areas of the body. And that is one really good way to begin to facilitate the healing process.
Can you teach us what that is? I want to try it right now.
Sure. So you can do this lying down. We can do it sitting up as well. So one thing, when I want to kind of get in some good posture, you have the small of your back with just that neutral curve. Put your hand on your chest and your other hand on your belly. It's helpful if you're not sure what you're doing to just close your eyes so you tune out all of the outside input. When you are breathing in, you want to think about your chest expanding in all directions. So the front, the back, the side and side. As you do that, as the chest expands, then the diaphragm presses down. It goes from a dome like this to more flat and down. And so it's coming into the abdominal space. And so your belly should come out. So as you breathe in, your chest should open and expand. And then when your diaphragm drops down, your belly should expand. So feel that belly hand coming outward as you exhale. And as you inhale, you let that belly come in first, and then the chest will get kind of brought in as well. So we're going to take that deep breath in, let your chest expand, and then your belly expand. And then when you're ready, let your belly come in and your chest come down. Just take a couple minutes to take a few nice deep breaths. Breathing in through your nose is also really, really helpful to help filter the air that's coming into your body. And maybe one last breath in whenever your timing says. And then whenever you're ready, you can open your eyes. And so taking the time every day to do that, maybe 5 or 10 or even 15 minutes if you can. An acupuncturist that I used to go to would say, what do you do to refill your energy? You're working with patients all day, you're depleting your own personal energy. What do you do? And I was like, I don't know. And so she said, in the afternoon, if you're feeling tired, that's the really good time to recharge. So lay down, put your feet up, put your hands in place, and get some breath into you to get some energy back into your system to recharge yourself. If you could do it out on the ground, when you're out on the grass where you have the healthiness of the ground, that would be even better. So anything to help build up your own personal healing energy supply.
Beautiful. I love it. Such a simple tool. It's something we're already doing is breathing, right? If we're here listening to this, you're likely breathing, but bringing that awareness to it and cultivating the ability to slow down your breath, to deepen your breath. So many benefits to that. And so thank you for teaching us that.
Welcome.
Is there anything that we've missed that you would want to share with this community of people who are perhaps looking for tools or new insights or struggling to find their own way through a complex journey?
Just that if you're alive and living, your body wants to heal. And that if you're still dealing with pain and dysfunction, there's something more that can be done. I know for a lot of patients, they feel like they've gone to therapy, they've gone to massage, they've gone to counseling, they've gone to doctors, and they're maybe feel that they're as good as they can get. But it's good to know that there's always the potential for more, and tapping into the things that led you to where you are now. There may be some things left unprocessed. And so, 20 years later after a car accident, you have a therapist at a place where there was an injury. This happened to me where, just working on that spot, this person had no awareness of any emotional connection to this location of an injury from a car accident, and working on that spot released this amazing level of heat. And I had said to her at that time, you might feel a little bit emotional today. And she was, not sure exactly why or what that was all about. Came back the next week and she said, I was crying I just cried on and off throughout the day. She said that was the craziest thing. So might not even realize that those things are there. If you went through anything in your life that was stressful, either low level stress over a prolonged period of time or something big that happened once, or illnesses, or just anything that was kind of hard or challenging, especially in your younger years when you just don't know how to process things, they could be kind of just still affecting you and causing that dysfunction or pain. The other thing is if you have more of a physical nerve related situation and things don't show up on tests, because these types of restrictions don't show up on our common medical testing devices, there could still be restrictions there that are causing the pain. So we have a lot of theories about pain sensitization and how the loops are going around and around because the nervous system is kind of messed up and it's sending these signals, even though the trigger or the insult's not there. But I have a sense that we just don't know what that trigger is. We just don't know what that insult is. We don't have the tests to identify it. So when we can tap into the body and be a gentle observer of what that body's been through and what they're currently dealing with, we can release things that are more subtle, especially within the nervous system. And once that system can be calmed down and move the way it's supposed to move, those pains can come down. And so the nerve isn't necessarily not working properly. It's just that we haven't identified where the problem is yet.
I'm so glad you said that. I think that that's really validating to hear. A lot of people who have complex, mysterious illnesses don't have lab values to support their symptoms or just to validate their suffering. And so that just recognition that, fear might not show up on an MRI, like locked anger and grief from your childhood is not going to show up in a blood test. That doesn't mean it's not real or that there aren't people who have tools to help you identify that and release that.
Yeah.
So speaking of people who have tools, from my own journey through my own suffering and pain illnesses in the past, I am aware that there are different types of physical therapists and different types of therapy practices. And so when I send patients to people, I'm sending them to you or people like you, people who are intuitive, people who put their hands on the person as opposed to just give them a list of exercises. A lot of people, their association with physical therapy or PT is you go to a big center, you are walked around a gym after a quick assessment, and you're kind of some exercises are demonstrated to strengthen this part or release that part, but they're not getting the same kind of treatment that I know you provide. So what advice would you have for someone who's looking for someone to work with who can do really good body work that's intuitive and compassionate?
First of all, if you're looking for a physical therapist, I think it's key to find a center where there's not a lot of gym equipment in there.
A lot of
A lot of like gym equipment,
Gym.
exercise equipment. So maybe there's some tubing bands and balance things, but not equipment that you're going to go on, because that's really glorified training. You want to be in a center where there's tables and a set amount of time where the therapist's hands are on you, and that you're with that same person over and over and over again, and they know exactly how you responded to the last session and how to tweak that. And where I've worked in the past, that was the kind of therapy that was given. It was all very much hands-on and looking and analyzing the body and the movements and figuring out where the alignment's off and what specific muscles are weak. And that's more traditional physical therapy, but that's good traditional physical therapy where you have a lot of more one-on-one time. Maybe there's another person in there with you going back and forth, but you still have a lot of hands-on time. Mm-hmm. For my practice, being that I primarily am working with abdominal and pelvic issues, the privacy requires the one-on-one session. But the majority of my session is all hands-on work because they can't tolerate a higher level of like exercise and movement yet initially and for a while. And so many different nerve restrictions will just cause things to flare and fire up. So we get to that later on, but it's later. I do some early stabilization work, but not necessarily right away, even with that. So really just kind of listening into the body and seeing where the greatest need is at that moment, at that session.
So hands-on work, more tables than equipment, which indicates that's where you're doing the work with someone who's got their hands on you. The same person over time who can really monitor what's going on. And the other thing I just want to note and just sort of emphasize from what I've heard you say is that it's not like a one-size-fits-all approach. Like everybody, if you're alive and breathing, can do something, even if it's just deepen your breathing, right? That's a form of movement. That's a form of physical therapy. It gets things flowing, gets your body moving, helps you start to identify where you're stuck and where your edge is, right? So I love the idea of a one-on-one consultant who's really working with you to figure out where you're starting and then ooch you along that path towards greater mobility and greater function. Mm-hmm. Yeah. Makes me want to come make another appointment with you, Lori. Listen, this has been so wonderful. Is there anything else that you'd like to add before we end?
I guess just believe in yourself, believe in your healing possibility. That's still there. If you're dealing with anything, whether it's pain or just movement issues, just know that if you still have an issue, that there's something more that can be done.
Beautiful. I love that reframe. It's not so much you still have an issue, you're still broken. It's more you still have an issue, there's still possibility for healing. It's a good place to end. Thank you again.
You're welcome. Bye-bye.
Bye. I hope you enjoyed this episode of the Healing Grove podcast. If you liked it, please be sure to like and subscribe. And if you want to deepen your experience further, consider grabbing a copy of the Healing Grove Playbook. With journal prompts for this podcast and 41 others, it's the perfect place to record your learnings, keep track of the tools you explore, and reflect on your own experience. Finally, it's important to mention that even though I am a doctor, nothing you hear on this podcast, whether from myself or my guests, constitutes medical advice. Any intervention you try should always be discussed with and supervised by a trusted member of your own healing team. Thanks for listening, and see you next time in the Healing Grove.